This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm T.G. Lafredo, and this week I'm coming to you from the KRMC Imaging Center. My guest is Shauna Davis. She is the Breast Health Navigator. Hey, Shauna, welcome.
Hello, thank you for having me.
Thank you for having me. We're here in your office. We've turned it into a little radio studio. Was that weird for you?
No, this works well.
You have to take a picture of it. And this was the day the weird guy came in and dragged the microphones and the cables everywhere.
I will. Memorable day.
This is the first time we've gotten to talk on the air. We chatted a little bit at the Cancer Survivors Luncheon. And, you're part of the community, especially at those moments where we're talking about the cancer survivors and, all they've been through. And you're, as the Breast Health Navigator here at KRMC, you're right in the heart of all of that. You hear a lot of amazing stories all the time, right?
I do, and I get to interact with some amazing individuals. It's very rewarding work.
Yeah. Forgive me, I'm not really... Has it been a year that you've been at KRMC?
It has been a year now.
How's it been? I guess if it's been awful, you won't be able to tell me on the radio,
It has
right?
not been awful. I can honestly say that it has been a wonderful experience. I just have learned so much from the ladies that I've been able to help and just my work here.
I have your business card here, and you have a bunch of initials after your name, so I'm going to put you on the spot, but I want... You're a PhD and an MBA.
MPA.
I should have brought my glasses today.
No, that's okay.
What is...
MPA, Masters in Public Administration.
Oh, okay.
And then the PhD, that's okay. That's okay. The PhD is in Public Affairs, emphasis in social policy.
Yeah. Were you thinking about being a politician or something?
I loved policy work, but I initially started my bachelor's degree is in human services counseling, and I just loved helping others. And it was through my education that I had an opportunity to participate in internships that I started working in the nonprofit arena, and I loved this area. So that is what swayed me to change my course, and I decided to get a master's in public administration. And from there, just loved the environment and learning about social policy. So I went on to pursue a PhD in public affairs.
You mentioned the nonprofit aspect of the hospital and the work here, and I've had several providers tell me over the years, they've worked in more for-profit settings, and they notice a real difference in the feel and the attitude and the way that just things work here.
Yes, I would agree. I love the nonprofit setting, especially being a nonprofit hospital, how we're able to give back. And one of the benefits of this is it makes my job easier because when I am here to help patients, and one of the barriers is financial difficulties, then we have several programs that can help. And KRMC itself has their own program, financial aid program to help patients.
So, and I guess I jumped ahead a little bit. We should back up and just say, who is the Breast Health Navigator? What is the job that you do here? You're in the imaging center. I know you end up, speaking with a lot of patients. I'm not really sure exactly what all you have to do, though. And
that is a good question because you are not alone. A lot of people ask me, well, what is a breast health navigator? And really my role is twofold. It's first, advocacy work, and secondly, it's outreach, educating our community members on the importance of getting yearly screening mammograms and general breast health.
Do a lot of medical facilities now have a breast health navigator, or is this still kind of a new role?
The position of a breast health navigator is one that is growing in popularity because facilities are noticing the need and the importance of having someone there to really support their patients and ensure that they are being able to navigate through the healthcare system, which can be quite cumbersome.
Yeah. Terry Williams over in KRMC Public Relations tells the story about how, she was part of getting the first breast health navigator we had here at KRMC, and just because she had learned about the position and she thought this would be really good, this would be really helpful for us to have. And a very short time later, she got her own breast cancer diagnosis. And so this program that she had helped to put in place, she got to experience it firsthand. Of course, not in a way that she really wanted to, but she got this whole different perspective on, because it's such an awful time to, you get diagnosed with breast cancer, and I think it would be hard to think straight about anything.
Exactly. And, it goes to show the passion of Terry herself, and that she noticed a need here and she went and made it happen. And so this position was created, and how fortunate we are that we have a position like this in a smaller town to help our women and men who are going through the process. But also, and Terry herself has said, one of the greatest things about this position is when she was diagnosed and she contacted, or rather the navigator contacted her, she needed that extra support and assistance at that time. And the navigator was able to schedule those appointments for her, guide her through the next steps, and how important that was for her when she just really couldn't take the time to think as far as what to do next. And the navigator was there to step in and help her.
And so when a patient comes to you, how does that, so the patient has just gotten a diagnosis of cancer, right? And then or how does it work?
Well, I actually step into the picture before they have that diagnosis of breast cancer. Yeah. So if a patient, for example, comes for a screening mammogram and is called back for additional diagnostic testing, so there was something that was seen on their images, that is when I come into the picture. Or another point of entry for women and men is that they might feel a lump or any signs and symptoms that will prompt a visit to their healthcare provider, who will then refer them to have further diagnostic imaging. So if anyone is going through that diagnostic process, that's where I come in to help explain any exams, ensure that they are fully aware of the next steps, and to see if there's any assistance that they need. Again, as we talked about, barriers that may prevent them from obtaining those necessary exams to get our answers that we need.
What are some of those barriers that keep people from the care they need?
The main ones that I've seen, number one is financial barriers. They might be recommended to come back for additional imaging, yet they feel they cannot afford it, or we have many uninsured and underinsured ladies that just simply feel they cannot afford to come in and get evaluated for any signs and symptoms that they may have. Yet we have programs here to help them with that. We have our Catch It Early program to help ladies receive the necessary exams that they need.
Let's come back to those barriers, because that's a great moment to just talk about Catch It Early. This is a program where really you shouldn't have any excuse. You do need a yearly mammogram, and you don't have any excuse in Mojave County, right?
Exactly. If you are a resident of Mojave County and at least 40 years of age or older, you qualify for a free screening mammogram through our Catch It Early program. And how this works is you just simply need to call our scheduling line and they will get you an appointment. Now, if you are uninsured, they'll schedule you for our one Saturday a month, where we will also have representatives from other programs there to see if you qualify for additional financial aid programs.
And I have that number handy to call for your screening, right? Your mammogram. And that number is 928-692-2727. That's 692-2727. So you call and you say, I'm uninsured or underinsured. I heard about this. I want to come in for my mammogram. And that's it.
And actually, it's all women. So even if you're insured and not even considered underinsured, if you have any out-of-pocket costs, and as long as you're a resident of Mojave County and at least 40 years of age or older, our Catch It Early program will automatically cover any remaining balance. So your screening mammogram is free.
If I'm not mistaken, this is made possible in part by a big grant through the Susan G. Komen Foundation. Is that right?
It was in the past years. However, now our Susan G. Komen grant, we're fortunate enough that we can apply that to the diagnostic services. And because through the generosity of community members, we still have Catch It Early funds available to continue that program to offer free screening mammograms.
Wow. So, but is this the sort of thing that happens in very many communities around the country?
It is uncommon, and especially in a smaller town that we're able to offer free screening mammograms. We're very fortunate because that is how we're able to bring ladies in that feel that they just simply cannot afford it.
So again, no excuses. Get in there and get your mammogram, right? And once you reach 40, you're supposed to get a yearly mammogram, correct?
Yearly screening mammograms are recommended starting at age 40 for women who are at average risk. Now, this is important, is for one to know your risk. You're considered at high risk if you have a first-degree relative, if you have a mother or a sister who has been diagnosed with breast cancer, then it's recommended that you talk with your healthcare physician and explain this family history to them. If you're at high risk, your healthcare physician will help determine when you should start screening mammograms. So if you're at average risk, you do not have that family history, then yes, 40 years of age or older, yearly screening mammograms. But if you're at high risk, you need to speak with your healthcare provider to determine when it is best to start screening mammograms.
It's time for a quick break on Focus on Your Health. We'll be back in a moment for more with Shauna Davis. Stick around. Support for the Arizona Community Radio Network is provided by Kingman Regional Medical Center. Modern medicine is changing what it means to receive a diagnosis of cancer. Dr. Edgardo Rivera and the team at the KRMC Cancer Center stay on the cutting edge of research and innovation, including the use of immunomodulators, or immunotherapy. KRMC. Welcome back to Focus on Your Health. I'm T.G. Lafredo, and this week I'm speaking with Shauna Davis. She's the Breast Health Navigator at KRMC. We were talking about the Catch It Early program, and we got into that line of thought because we were talking about some of the barriers, the common barriers that keep people from, in this case women, right, from the care they need, from coming out and getting their yearly mammograms. You mentioned that there are 3. So we talked about finances. Of course, that's the barrier to everything in our world.
Right.
What are some of the other excuses or barriers that you see often?
Well, another prominent one would be fear. If ladies are scared of knowing if they have breast cancer, they try to avoid having a screening mammogram because at this point they don't want to know. And this is where I can talk to them and educate them on the importance of getting a screening mammogram, because we want to catch breast cancer early when it's most treatable and the survival rates are highest.
I remember some time ago I spoke with Dr. Christopher Johansson about the ability to treat breast cancer early, right? And how crucial that is. This is what he had to say about it.
That's amazingly important. The benefit from mammography and just in general from breast exams, anything like that, all comes from the fact that smaller breast cancers are easier to treat, they're cheaper to treat, and we have better success rates. So for instance, if you have a stage 0 breast cancer, something called ductal carcinoma in situ, it's basically the precursor to an invasive breast cancer, and you treat that effectively, you'll have a cure rate that is incredibly high. The life expectancy of that person will be as close to unaffected as any doctor will ever say. Unfortunately, if you have a stage 4 breast cancer, a cancer that's already starting to spread outside of the axilla, the armpits, and the breast, that cure rate drops essentially to 0.
Wow.
At that point, you can use all sorts of really intense techniques like chemotherapy to fight a rear guard battle. And then everything in between those two falls somewhere in the middle. You have to use some of these advanced techniques. It takes longer to fight, and we don't do quite as well. So the earlier that you can find breast cancer, the better off you are in basically every way we can measure. Mammography's big advantage is that it can find things when they're particularly small, before you can feel them on exam, before you can see a difference in the breast. It can find things that are very amenable to treatment. Some cancers will grow much faster than others. You'll not go to sleep one night with no cancer and wake up with stage 4.
Right.
But some cancers can go very quickly. They can go from a point where literally the first physical symptom is a is a stage 4 breast cancer.
Wow.
It's unusual to have someone who's being screened yearly with mammography get to that point, but not impossible.
Right.
It's important that we don't oversell mammography. It's an incredibly useful technique, but it's not a silver bullet that will catch every breast cancer and eliminate morbidity and mortality from breast cancer. But it is, without a doubt, the best tool we have and the most effective tool we have to make sure that as many women survive breast cancer as possible. For the typical woman who doesn't have some sort of unusual genetic syndrome or incredibly strong family history, the absolute best thing you can do to avoid dying from breast cancer is get a yearly mammogram.
Do you ever have somebody call you up and say, hey, my sister won't come in? I want you to employ some strong arm tactics. I want you to grab her or something like that. Do you ever have to intervene?
I have
really
had some ladies tell me, I have a sister or a friend, and they just simply will not come in. And one thing is, yes, we can educate them and make sure they have that knowledge, but ultimately it is their choice. So we're here for them and we'll help them however we can, but it is their choice.
This is part of that outreach you were talking about earlier, where I know you do a lot of public appearances. You have, in October, you guys have a ton of events that you're at, and you're kind of out there spreading the good word about how important this is.
Yes, we want our community members to know the prevalence of breast cancer and the importance of getting their yearly screening mammograms. According to the American Cancer Society, it is estimated that over 250,000 new cases of invasive breast cancers will be diagnosed in women in the United States in 2017. And of these, it's estimated that 40,000 women will die of breast cancer. So we want our community members to know that it is prevalent, but by getting their yearly screening mammogram, we can reduce these numbers.
Right. And also the outlier there is that there are some men who get breast cancer.
Yes, that is correct. So it's important that men are aware of what's normal for them, and if they feel any lumps, that they see their doctor and they get the diagnostic testing to get the answers that we need.
That third common barrier to access that you see is
simply being unfamiliar with the screening guidelines, not knowing that it's recommended to come in yearly.
I know that there's always a call for volunteers here, and especially for people who are going through cancer treatments. For people who want to get involved, what do they need to know?
There are several ways that they can get involved. The first is to know your risk and make sure that you get your own screening mammogram. Secondly, we have family and friends and loved ones. Spread the word. Don't be afraid to ask, did you get your screening mammogram? We also have a lending library where we take donations. So if you have any books on breast cancer, feel free to donate them. These books are made available to our ladies who are diagnosed. Oftentimes what I found is that the women were spending a lot of money buying books and not knowing which books to buy. And so now we have a lending library that they can check out a book and bring it back and check out as many books as they need to while they're learning about the process and different treatment options. And lastly, they can become a KRMC volunteer where they can help at our outreach fairs and help spread the word to our community members about the importance of yearly screening mammograms.
Previously, we have talked about volunteering, and I have the number for KRMC Volunteer Services. I'd like to give that out right now. You want to call Kelly Truver. Her number is 928-263-5673. That's 263-5673. If you're sitting there thinking, I would like to volunteer and take part in this in some way, give Kelly a call. They're always looking for good people to help out. And you don't have to have any sort of specialized skills or training. They will help you to fill the role that, really helps here in your community. So there's that. I wanted to share that. And we would be remiss if we didn't talk about some of the signs and symptoms. What do people need to know?
When talking about signs and symptoms, the most important thing to keep in mind is knowing what's normal for you. And if anything is out of the usual, then this would prompt an appointment with your healthcare provider. For example, if there's any lumps, swelling, warmth, redness, dimpling of the skin, any sores, again, anything that isn't normal for you, go see your doctor about it.
Shauna, I can't help but feel that this has got to be a very challenging job, dealing with people, trying to help them through a very difficult time in their lives. To me, it seems like it might be just exhausting.
You know, you're not the first person to have said that to me, or other people have said, you know, I couldn't do your job, but I love my job because I love the people that I meet, the women that I'm able to help, and the men. I have learned so many lessons about life through these ladies. There are women who are diagnosed and going through some of the most difficult times in their life, and yet they think to take the time and write a thank you note to our doctors and the staff here. And I'm always in awe that during this difficult time, they are taking time to think of others. That's one of the lessons I try to hold on to and remember, is to always be grateful and thank others. Another lady told me once that, you know, she didn't want to let her older children know that she possibly had breast cancer. She was undergoing a biopsy, and she changed her mind though, and she ended up telling her children. Now they were older, and I asked her, well, what made you change your mind? And she said, you know, the more I thought about it, I realized this could be used as a great teaching moment. I want my children to see that it's going to be okay, no matter what. And I want them to see how I handle trials, and for them to know that no matter what, it's going to be okay. What a great lesson, that we can be examples to others, and that we can take control of the situation and determine how we want to handle these trials. That is another great lesson that I've learned through these amazing women. Another amazing woman that I had the opportunity to help and support when she received her cancer diagnosis is she told me the first thing that she wanted to do is to spend time with her daughters. And so on a Saturday morning, bright and early, they went to breakfast, her and her daughters, and she realized to celebrate every moment that we may have taken for granted previously, and to value each moment we have with our family members. I've also seen and heard such powerful stories of love, just even seeing a loving husband gently hold his wife's hand, knowing what she's going through, and he wants to take that pain away, and he's there for support, just gently and lovingly holding her hand. I've heard stories of ladies who are recovering from surgery and how amazing their family members, even neighbors and friends, come to support and show their love for these ladies. I've also learned to slow down, to take a moment and just breathe, be in the present, and to keep the perspective on what's important, to have a balance in life, and most importantly, to cherish every moment.
Those are some really nice life lessons from people who are going through really difficult times, people who are surviving. And having said survivor, I've recently become aware that it's the definition of survivor is maybe a point of contention, or there's something more to it. How does one define survivor?
TG, that is probably the most important question you have asked me, because many of our ladies will even struggle with this. Am I a survivor? The moment you receive your diagnosis of cancer, you are a survivor because you are surviving.
That's Shauna Davis. She is the Breast Health Navigator at KRMC. And if you're overdue for your yearly mammogram, call the Imaging Center at 928-692-2727. That's 692-2727. And that's Focus on Your Health for this week. I'm TG Lafredo. Thanks so much for listening. If you'd like to get in touch with me, you can send me an email at foyhradio@gmail.com. That's Focus on Your Health. foyhradio@gmail.com. We'll catch you next week. You can say anything you want. It's your office.